name is Rajesh Kumar, and I live here in Bangalore. I run a company in specialty chemicals, epoxy coatings business.
Okay. What is that element that you've been treated with Dr. Silvotam, and how long have you been suffering?
So, I've been having this problem with my upper back, my neck, and the lower back area for the last maybe 20 years. Over a period of time, the age is degraded. I have probably been treated, all around the world. These doctors in the US and there, namely are both in north and south. So quite a few people have, looked at it. Most of them have prognosed that, I either have some kind of spondylosis or, I have some kind of degradation in my spinal structure, leading to the pain I used to endure. And sometimes it's really bad. And so, nobody's, really being able to correct or, give me relief, so far in terms of the pain.
Right. So the condition, you said you have spondylosis, is something that you've been suffering from a few years now. Now, would that be the condition you've been already treated with some other physician? Is that condition in a past where you have recommended for a surgery, an invasive surgery?
So I've never been recommended for a surgery because, both, regular orthopedic doctors, I've been to acupuncture specialists, I've even in Singapore been treated under traditional Chinese therapy medicine. But none of them have, kind of said that I need to have a surgery, but most of them said, they've been able to give me temporary relief with some of their, in some cases medicine, some cases therapy, and some cases, acupuncture or massage and stuff. But I think most of them basically told me that, I'll have to keep exercising and, just get relief rather than, any kind of, sustained relief, that I was expecting.
Right. So the condition or the spondylosis, which you've been suffering, how extensive or how acute was it when you came and saw Dr. Vijay, and how has it been now?
So it was quite acute because I work a lot on computers and stuff, and I could not sit for too long. If I did not exercise one day, or if I had a long road travel, my whole body would be in pain, and there'll be days and I don't feel like getting up in the morning. And this is off and on. Some days I'm fine, some days it's really bad. So it's not a consistent thing. Right? And I do exercise every day in the morning and just for my neck and lower back. So that was a condition when I came to Dr. Vijay, and he was referred to me by a friend who had gotten treated with him quite a few years back. And then I did some research on the net, and I talked to a few people, and then I just came down over here just to try it out because given I've tried out pretty much everything I thought why not.
Right. So what about how long have you been seeing doctor for this condition? Has it been a month or so?
I've been seeing him probably more than a month. I think maybe this is my 6th or 7th week.
7th week. And how often would you sit? What are the sessions, or how many takes would it take?
So initially, I think I had daily sessions for the first 2 weeks. Then it got down to 2 sessions a week, and now it's 1 session a week, and that's how it's been so far.
Okay. So you've been referred with a common friend, as you got to know, and then again on the website and things. So how do you feel now, and what is your message to the doctor?
So I think I am quite happy with the progress. Recently I've been traveling a lot, and I just feel that I don't have the kind of pain I normally have in these kind of situations. And so I can definitely feel a lot of difference. And initially, though I was skeptical, now I've actually started telling my friends about this guy and the doctor, and telling them, if you have any kind of back problem, it may be worthwhile to have take a look at it because it's been so far very good.
Interesting.
And, that's it.
Thank you for that, sir. Thank you for your message, and it's been great that we've been having heard about it. And I mean, you would really want to speak something about acupressure as a whole, like now that you've known and you've been treated as acupressure, because people really hardly get to know what acupressure is. So you want to say something about acupressure?
Right. I think when initially I heard of acupressure, I mean, I was really thinking, one, I think a lot of people associate it with, pins and needles, which is more acupuncture, and two, I think, we think, it's about, a lot of pressure points being pressed and stuff like that, and I also thought, I would have to go through hours of things, being done and stuff, manipulated, but I think, having seen him operate, it's quite a simple, procedure in terms of manipulation of some pressure points, and you're off back to your normal life. It does take slightly longer time during the initial stages, but once you get a sustained relief, then it's a 10-minute job. So I would definitely think, I personally think it's great whatever magic he has in his hand, and I would probably, tell people that, if they have any kind of pain, and, instead of going to a traditional Western, medical practitioner like an orthopedic, I would recommend them having this guy take a look at you and see it, and if he can help you out.
Great. Well, thank you for that, sir, and it's been really nice speaking to you. Thank you for being with us.